Today, we're talking with Frank Riegler. He's a nurse manager at the VA Medical Center of Cincinnati. Frank, great to talk with you today.
Yeah, thanks for having me today.
We know that cardiovascular disease is something that affects many veterans. What is cardiovascular disease?
Well, that's a great question. Cardiovascular disease is really any disease process that kind of affects your blood vessels, whether it's your heart or your brain. So a lot of the diseases that we hear about are peripheral artery disease, heart attacks, strokes. So all of those diseases are really going to encompass coronary artery disease.
What sort of symptoms should our veterans look out for when it comes to spotting cardiovascular disease?
So this is where it gets a little tricky because everybody always hears chest pain, and chest pain is a great indicator of people having chest pain. It's a great indicator of coronary artery disease. Some of the lesser known ones are jaw pain, shoulder pain, and sometimes something as simple as shortness of breath can be an indicator for some of this heart disease that's going on over time. So, we ask that any veteran or anybody that's having these symptoms, let your primary provider know and let them do a little bit of the legwork, and then we can get you up to the cardiology department where we can ask some of these more specific questions and really start to hone in on some of these cardiac related issues.
How do you typically evaluate veterans for cardiovascular disease?
The first step is really that the veterans, they come in and they need to have an appointment with their cardiologist. They talk about their symptoms, what's going on, what's happening in their lives. If everything kind of points to the direction of some of these disease processes, we'll do some advanced tests and some advanced procedures. So one of those that we do frequently is a cardiac heart catheterization. And that's where we're taking them into a procedure much like we're in right now, and we go ahead and we look at the blood supply to the heart. And we look at all the vessels inside the heart and see if there's any narrowing or blockages. And if there are, we evaluate that if that's something that we can fix today on the spot, or if it's something that requires a little more advanced either surgery or just conversation about what's going to be best for the veteran.
If folks want to schedule an appointment, how can they go about doing that?
So they can do that, obviously when they're with their provider, they can do that at the same time. They can also call us here at the Cincinnati VA at 513-861-3100. And then we can start working through the problems and start getting them up to the department where they need to get their problems addressed.
Frank Riegler, nurse manager at the VA Medical Center of Cincinnati. Thanks again for talking to us today.